For the full face shots, this is probably the easiest setup that we have. We're simply going to turn the camera on. We'll go ahead and touch the back of the screen and hit in the mode button the full face shot. So we hit the face shot, and this is pretty much going to set the camera to do what it needs to do. You're going to notice that the distance you're going to be to get these shots is about 39 inches away. To get a great facial image, we're first going to focus on positioning the patient properly. So getting this patient to stand about a foot away from your backdrop. A black backdrop works great for this. We're just going to walk over to the patient and make sure that their head, their interpupillary line, is parallel to the floor and their head is slightly tipped forward. Think about their occlusal plane being parallel to the floor. Patients have the tendency to bring their chin back, and so you want to avoid that. The next thing we're going to do, we showed you how to set the camera up before, but we're just going to bring it up. And now the facial shot tends to default at about 66 inches away. For the Dawson shots, we're going to be one step closer, which is about 39 inches away. Remember that we want to be able to get from basically the shoulders to the top of her head. Now the next thing we're going to do, as we're seeing here, is that we want to make sure that the camera is basically at the level of her nose. And if you do those three things, we can quickly take our three shots. The first one is just going to be a nice relaxed smile. So we'll have that patient smile and then expose the picture. The second shot we're going to do is we're just going to turn the patient 90 degrees. So if we'll go ahead and turn the patient 90 degrees, and again make sure that chin is down. This picture is very important for orthodontists because, as you'll see later when we put these pictures into the Dawson Diagnostic Wizard, this is how we go ahead and verify the different positions of the mandible and the maxilla to one another. So again, having that picture parallel to basically the tip of her nose, then we can expose the picture. The last facial shot we're going to do is with retractors. And so what we'll do is basically get the retractors in the patient's mouth and let the patient go ahead and grab the retractors and pull forward. And you're going to see that this is what we're going to do with the intraoral shots as well. Notice how we also repositions the patient's head so that maxillary occlusal plane is parallel with the floor. Then from about 39 inches away, we're going to go ahead and then expose the picture. This picture is very important because it allows us to verify any cants to the maxillary occlusal plane in relationship to interpupillary line, and we'll show you exactly why that is later.